What's up guys, Dr. Greg here with Movement Driven Performance Physiotherapy. Today we're going to talk about some balance progressions. Okay, so balance is a key part of athletic performance that I think is missing in a lot of people's programs. It's also a key part of injury prevention. Okay, so when we're out on that field, we have a lot of things to kind of pay attention to. So if I'm a football player and I'm a running back and I'm holding that ball and I'm traveling, I'm running, I'm looking at who's going to tackle me this way, who's coming this way. Maybe it's a little wet because it rained, so I'm worrying about where my footing's going to be and how I'm going to cut to the next to run my route. So there's lots of things that our mind is preoccupied with, and because of that, it's hard to kind of do everything in perfect form. So balance and what we call proprioception is really important in the little sensors in our muscles and our joint capsules and our ligaments, these little sensors that relay information to our brain of where we are in space, so that if my eyes and my cognition is focused on something else, I still have my brain corresponding with these little sensors to kind of keep my knee from caving in or something like that when I'm cutting, to help prevent that injury, prevent that ACL tear or whatever it is. So what I like to start with is this simple routine here. If you can't master the routine I'm about to show you, then you shouldn't be doing things on BOSU balls and crazy single leg deadlifts. We need to master static balance with some variations added in before we can progress to some higher level stuff. So the first thing that we want to master is a single leg stance, okay? So if we can't master this, then we shouldn't be doing anything else. So with my single leg stance, I like to drive that knee as high as I can, but I don't want to round my back to get it there, okay? I'm good posture, and then I'm just putting it on that hip flexor there. So for here, I'm just holding. I'm picking a point, I'm staying still, I'm holding that posture. Okay, and then what I like to do is I like to add head turns. This is going to challenge what we call your vestibular system or your inner ear, which is also one of the key dynamic points that's contributing to you maintaining balance. Okay, so we talked about vision, we talked about the proprioceptors in the muscles and the joints and the ligaments, and now we're talking about our vestibular system, which is our inner ear, which tells our brain where our head is in space. Am I going up and down on an elevator? Am I going upside down on a roller coaster? Am I driving in a car? Am I turning? Whatever I'm doing, it's relaying that information to my brain so that I can maintain balance. So we want to challenge that. So back in this posture, I mastered eyes open, straight forward. Now I'm going to keep eyes open, and I'm going to do nice slow head turns. This is harder than it looks, okay? Slower is better. Don't do this. This is easier. Nice and slow. And you can feel, or I can feel my ankle muscles on fire, my hip muscles on fire to stabilize all that, okay? After I do that, I move to eyes closed. So now same position, and now I'm just focusing on keeping my eyes closed. And you're gonna feel some sway. Sway is okay. Sway means you're challenging your system, okay? So if you're going back and forth a little bit, all that's fine. I tell my patients, if you're messy and you're looking like this and you can't, I'm okay with that. Don't just fall out. Stay in it and really try to balance and find that center, okay? So eyes closed, that's where I like to be. And then after that, I like to start with a simple balance foam pad, nothing crazy, but essentially we're just progressing everything we just learned, but now we're seeing if we do it on a dynamic surface that's adding another element of difficulty to my balance. So same thing, I can do the eyes open, I can add the head turns, and then I can try eyes closed, okay? Now after that, then I start to I like to start adding movement patterns in. So then we can start to do hip flexion, we can start to do hip abduction, we can do circumduction back and forth, we can do hip cars, we can do lots of different things. We can turn our torso back and forth, okay? So there's lots of different ways to progress that static balance. The single leg deadlift, like I talked about before, lots of different cool movement patterns to do. But like I said, master those simple static movements or those static holds before you progress, okay? If you're an athlete or anybody that just wants to be active, get this in your program if it's not in there. All right, guys, good luck.